Response to what?
Ready? Friends, now we are in the sixth pillar. And sixth pillar people, team, sixth pillar team, I have, we have named the name of the guy, and what you have said, pillar 6 is a nation where the best of healthcare is available to all. You have indicated that awareness levels profile awareness level people, poor and low income groups about prevalent diseases related to hygiene, sanitation, nutrition. It is very important. Most of the time, the awareness is not there. Awareness. Recently, I inaugurated in Bombay awareness program for health and mind. Yeah? Happy and mind. Happy
body and mind.
And 20,000 doctors are participating. Whatever diseases?
It is chronic diseases.
Chronic diseases.
For containment, combating chronic diseases through community intervention.
And they are penetrating the society. Another thing, TB. TB also is a killer. There also awareness we have to improve. Role played by the existing health institutions, NGOs and community service centers, particularly prevention. Prevention we do zero. Definitely is going to be a big area. I am going to coming to that. The extent of networking of the existing infrastructure went back. For example, there are primary health centers in the nation, but you will be surprised, not even 10% working primary health centers. Area specific of disease preventive measure for the same. Improvement and policies for better health care. That something has come. And these are the few suggestions has come. Anybody would like to add now? In this group, health pillar. Would you like to add health pillar? Yes.
Sir, I would say you should focus on the close to client systems, where it should be a mix of both state and the center at all the levels, financed by the state, and for emergency services, it needs to be required for there to be a contract of services both for the profit, from the profit and the non-profit service providers. For example, as in the case of Andhra Pradesh, I see 108 ambulance service which has been provided to remote
here also.
Remote areas
Here also. Gujarat also here has come.
Which needs to be replicated.
Yes. It's a good point. Good point. Now, in the 108, it is called Emergency Management Research Institute, and it is spread now. 10 states have accepted discuss. We are going to discuss. We are going to discuss. So, would you like to say? Yes.
So, our healthcare, given that we enjoy a lot of cost economies, can not just be used by our own people, but also people from outside the nation, people coming from the underdeveloped nations, the poorer nations, or the poorer sections of even the developed nations. So maybe healthcare can also be used as a tool to act as a hub around the world for poor people.
For business, health business,
Health tourism.
Health tourism. But quality is very important. Quality and service. Definitely, but Kerala is trying to do in a big way. Kerala and few states, Delhi, Kerala and Delhi. But I agree with you. That's
Sir, in this, one point can be added is that the government hospitals and the government institutions which are working, the quality and the facilities available there are very substandard. In fact, people, if they have a little bit of means to pay some extra money, they avoid government hospitals and go to private. And in fact, in case of some rural people who are do not have the access to go to particular hospital, if by just by being they have to go to government hospital just because they don't have the means to pay for the high fees for the private hospitals. So the development of the government hospitals is also very necessary.
Actually, this 108, they have enlisted 4,000 hospitals in Hyderabad, in Andhra Pradesh. So, in turn, as soon as the person, a delivery case, or cardiac case, or road accident case, they take 14 minutes from the urban area to the hospital. The hospital, how we should be geared up? Most of them government hospitals. How we should be geared up also, they give recommendation in the form of a research document. I hope it will have an impact. The EMRI, we are pushing them, I am there. They are pushing them so that they bring research document for road, for most of the time the road accident takes place particular area. How to improve the road construction, and then how to improve the primary health center, how to improve the hospital, the district hospital, third hospital. All these comes with the recommendations. It's a good point, yes. 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 Go ahead.
So, just I'm quoting from a research report in the healthcare sector. As compared to the world, the government of India is spending on healthcare sectors around 10 to 15 times, or maybe even more, as a percentage of GDP. It's less than it's 10 to 15 times less than the average figure in the world.
It is 1.8.
I'm sorry.
1.8% of the GDP.
But we spend 1.8% of our GDP, less, I agree with you.
And so far the initiatives have not been substantial enough. If you look at the adult healthcare sector, then it's only due to hospitals such as Apollo, Fortis, Walker, etc., because of which we have some quality levels. And as he said, the quality in the government hospitals is very substandard, and even our national leaders go abroad for treatments. And if you look at child mortality rates, which is I'm coming to pediatric care, I mean, mostly maybe under 14. If you look at that, then India has a very high child mortality rate. So in that sector, there is neither private participation nor there is any government initiative. So I think the government of India should also just focus on this gap which is currently there, and try and sort of make up for its past apathy of this sector.
Yes, it's a good point. Yes.
One question. Would the promotion of indigenous knowledge and technology, which is there with the tribal population or in the remotest rural areas, would that also come under this pillar, promoting that technique, the use of
Yes, definitely we have to add that.